The COVID-19 treatment model in Korea has greatly changed since March 1, 2020. In the past, all confirmed patients were required to be hospitalized. However, as a result of the spike in number of confirmed cases within certain groups and the issue of insufficient hospital beds, the treatment model was restructured. Classifying patients in accordance to the severity classification system was devised on the foundation of analysis of different factors, including the spread pattern of the virus and the availability of medical resources in each region. The fact that more than 80% of the confirmed patients are patients with mild symptoms. Given that to reduce the number of deaths, patients with severe symptoms must be assigned hospital beds first. And the medical experts' opinion on the need to optimize the use of medical resources by minimizing the risk of healthcare workers were all taken into account to build the system. The quarantine authorities classified confirmed patients in 4 levels by severity: critical, severe, moderate, asymptomatic, or mild. The aim was to concentrate the available medical resources to the severe patients. Critical patients and severe patients are treated in National Designated Isolation Unit equipped with negative pressure isolation rooms and other essential facilities that are capable of providing specialized treatment for infectious diseases. Negative pressure isolation rooms prevent contamination between rooms and maintain the negative air pressure within a room through ventilation equipment, allowing external air to enter the room by preventing the air within the room from leaving. Shower rooms and bathrooms that are connected to the hospital rooms must be included in this process. As for the treatment for the confirmed patients, allopathies such as saline solution and fever reducers are used. Moderate patients who do not have severe symptoms but require hospitalized care are treated in hospitals dedicated to infectious disease, in which existing hospital beds are rearranged for COVID-19 patients' treatment. Asymptomatic or mild cases requiring low level of hospitalized care are treated in residential treatment centers. Residential treatment centers are government-managed accommodations and private training institutes equipped with dedicated healthcare workers and medical equipment. Patient Management app is installed on each patient's smartphone, and the patients are to enter their temperatures and blood pressures. The healthcare workers are able to check the patient's health status in real time through the computer monitor dashboards within the center. When patient symptoms exacerbate, an alert is triggered automatically for immediate actions to be taken. Thanks to this system, it is now possible to treat many mild patients with minimal number of healthcare workers, minimizing the contact between healthcare workers and patients. Medical resources are optimally used, even for the patient transfer process to treatment centers. First responders pay keen attention to the medical history, recent overseas trips, and key symptoms of patients to ensure that the first response team is well aware of them. Firefighter paramedics wear level D protective suits to prevent infection. However, when emergency patients are in need of proper medical treatment, existing policies for emergency responses are utilized, followed by a home quarantine of 14 days for the first responders. Outside of the vehicle, 1 to 2 meter distance with the patient must be maintained. And the distance must be maintained inside the vehicle as well when no further treatment is required after a general checkup. The patient must wear a mask, and the guardian accompanying the patient in the transfer vehicle must wear level D protective suit as well, even when the guardian accompanying the patient is advised to maintain 1 to 2 meter distance from the patient. After the patient has been admitted to a medical facility, the emergency transfer vehicle is disinfected according to disinfection guidelines. After the first responders return to the center, the emergency vehicle, protective gears, and the first responders go through another round of disinfection and sanitization. In the next video, we will learn about the quarantine system, which enabled Korea to practice openness and take action.